Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together. And today our subject is fall prevention. And we are joined today by Dr. Jennifer Bales, who is a Reid physician in our emergency management team.
Hello.
Welcome, Dr. Bales.
Thank you. Thank you for having me.
Before we get started, tell us a little bit about your background and how long you've been at Reid.
Well, I'm an emergency physician, specialty trained in emergency physician. People are always asking me if I have a practice, but it's in the ER, that's it. And I've been with Reid just a little bit over 19 years, long time.
Wow. And because I just saw a picture on social media, I have to bring this up.
Of course.
And of those 19, you have a senior.
I do.
Who's graduating.
I do.
With like the coolest picture.
Oh, thanks. He just turned 18. Yep, that's him. Yep.
So you've got a lot of things personally that you can have to get ready for this year.
Yes,
so.
it's big.
Oh, great. Let's go back and let's talk about some causes of falls.
Yeah, so falls are really important. We see a lot of falls in the emergency department, and you think about your standard trips and bumps and just accidents and whatnot, but then there's also a lot of medical things that make us fall. There are a lot of falls like every year. Certainly as we age, we become more at risk for falls, and about 1 in 4 people over the age of 65 will fall every year. Now some people are making up the average right there, and falling more than once, but that's the average, and that leads to a lot of ER visits, which is good job security for me, but probably nobody really wants to go to the ER. I recognize
right.
that. But that's about, 3 million ER visits a year in this country. Wow. And a whole lot of hospitalizations. And it's not just that, right? It's not just the inconvenience of going to the ER or the pain of being hospitalized, but it can also lead to death. There's about 35,000 deaths every year that are related to falls.
Those statistics are...
They're scary, right?
Pretty
They're
scary.
Yeah, it's worth talking about.
And are people at a higher risk of falls as they age?
Oh, sure. So there are a lot of things that change as we age. Vision, for one, is one thing. There are several age-related vision diseases, some that are specific to various disease types like diabetic retinopathy, but there are other vision-related changes that just happen because we get older. Age-related presbyopia is one of them, and I know I made that sound really fancy, right?
But what's that mean?
Right, yeah, that's, because we all wear reading glasses,
yeah.
right? Because I just got mine last year,
okay.
which I held out a little while, I'm like, oh no, it's not blurry, I'm fine, but that's a normal part of aging. That lens just gets stiff, and then it's a little bit harder to focus. And it's not so much that puts you at risk for falls, but it's those bifocals, right? So then you start wearing those glasses that have the 2 separate lenses, the one for far vision on the top and the reading glasses at the bottom. Well, but then you're walking into a store or something, and you look down at that curb, but you're looking through your reading glasses, and then it's a little bit out of focus. Right. So that leads to a trip and a fall, then an injury.
If you get new glasses,
you're
so accustomed to one kind.
Right.
Then the other's like, whoa.
Well, it takes a little bit more effort to focus. It affects that depth perception. And there's also cataracts, right? Cataracts are so common that they're basically considered a normal part of aging. That's related to like the protein breakdown in the lens, so it's just something that happens with time. And it really affects your night vision. So then you think about like you're in bed, like sleeping, you wake up for whatever reason, have to go to the bathroom, loud crazy noise, whatever, but now you have impaired night vision, that leads to a fall. We see a lot of falls in the middle of the night, or people that fell and then weren't found till the morning. So that's pretty dangerous.
What's some of the issues if they haven't been found quickly?
Well,
that
if you're
could-
found, right, yes. Being on the ground for a while is really dangerous. I mean, first off, there's the severe amount of pain from whatever injury you've had, but then just also the pressure. You know, when you sleep, you move around a little bit, but when you have fallen and you're down and you can't move, you get pressure sores that can lead to muscle breakdown. Sometimes you're trapped in a bad position and it can affect your breathing. I mean, it can be a problem for sure.
Wow, I've never even thought about the
Oh,
cataract
yeah,
issue.
it's very dangerous. It's why people who live alone are at a little bit more risk, is because sometimes they're just not there, you know, to call for help or, you know, to get help quickly.
Definitely having friends and caregivers that check on you or
Yeah.
keeping, so somebody's always looking out
Yeah.
for you.
Yeah. Other things as we age, you know, you also have to think about your muscle strength and balance. So this isn't really good news, but as we age, no matter how hard we try, we have some natural muscle loss. It's about 5% a decade after your 30s and progresses faster as you get even older. So you really have to fight against that because it's your muscle strength that will keep you standing when you have something like a little trip over a curb.
Right.
And then there's also balance. And I like to think of balance as a symphony in the body, right? So it takes a little bit of everything to put it together. You're using your vision to see where you are in the world, right? And then you're using your brain to interpret that information. Then you're using your vestibular system, which is that inner ear part that keeps you upright, that manages your balance.
Okay.
And then you're using your nerves to sense things. You feel your feet, you feel where your ground are, you feel that you're sitting on the chair, you feel with your hands, and then your muscle to keep you sitting in a certain way or so that you don't fall over. Well, if there's any insult to any of that symphony, then it's just a mess. So let's say you have an illness that unrelated to falls or specifically to balance. Let's say you have arthritis in your hip, right? So that's a muscle bony problem, like in your hip, and then you've got a little bit of limp, and that leads to you being off balance. So anything, any sort of insult to any of that can lead to balance problems. And then, unfortunately, just with age, those processes decline over time, and we get a little bit off balance.
So now if you kind of trip, it's like, oh no. So you're trying to make sure you don't just wipe out.
So you think about like a grandmother and a granddaughter walking down the sidewalk. So I live in an old neighborhood with really uneven sidewalks, right? They walk down the sidewalk together, and you know there's just a little lip there, and let's say they both trip. You know, my daughter is gonna pirouette around and dart forward, and then bow like, oh, I'm fine, no problem. But my mother, for instance, may fall down, right? I mean, she's not going to be able to respond quite like that.
Right.
And then that fall's going to have more consequences than if, say, my daughter fell on the ground,
Because her bones are set up a little differently now.
Yep, and she hit the ground, whereas, when you're younger, you're just better about staying on your feet.
Right.
Yeah.
I'm learning that.
Yes. Yes.
So people might not think it's a big deal if they occasionally fall. Can you talk about why we should take it more seriously?
Well, I mean, you can really sustain some serious injuries, right? So I guess the first thing people think of is probably broken bones, right? So you got a lot of bones to break, and we see a lot related to falls. So ribs, and that can be very painful, takes a long time to heal, and hurts a lot every time you breathe, which is all the time, right? Wrists, we see a lot of wrist fractures, ankle fractures, hip fractures are really common. Hip fractures have a lot of morbidity and mortality associated with them, and about 95% of hip fractures just occur from a fall from standing. They just fell down on their side and broke their hip. And, almost always that leads to an ER visit, a hospitalization, a surgery, and a lot of rehab afterwards. So it's got some pretty significant consequences, even just a fall from standing. Then there's head injury. And I think a lot of people think about really bad head injury or traumatic brain injury from like car accidents, but actually most traumatic brain injuries are just from falls. And as we get older, we're really more susceptible to those and to the danger related to them. It's just one of those things that as you age, the membranes that hold your brain inside the skull, they get a little stiffer, a little bit less pliable and flexible. Also, your brain shrinks a little bit, which I know is really sad, but it just does. It shrinks a little bit, and it leaves a little bit of space in there that's filled with fluid. But then when you fall down, it's shaken, right? And it's really not supposed to do that. And then a lot of us are on medications like blood thinners, and those blood thinners are very important, and they protect you from a lot of other problems, but they're not your friend when you fall. So that's a pretty significant risk.
Well, we had a situation with my grandmother.
Yeah?
And one of her things was she loved to wash dishes. And when
she can come over to my house anytime. Anytime.
The problem was you couldn't get to eat dinner.
Oh, okay.
Because she was so into the bubbles. So, but one of the last times she had dementia, but she still could talk and communicate. And she literally was washing dishes, and then her hip went out and she was on the floor.
Oh.
And that was the first time I'd ever learned about people can just be standing and boom.
Can happen for a lot of different reasons.
Right.
Yeah,
And
absolutely.
so from then it kind of spiraled. But that was the first time it's like, she was just standing there. What happened?
Well, and it's certainly traumatic for that person, for the patient, if you will, but also for the whole family and everybody that loves them.
Right.
And now the person who has to do the dishes, right? So.
Absolutely.
Well, so you also think about your simple sprains and strains and contusions, but I think we all know that when we're younger, those hardly slow you down, right? You might sprain your ankle on the basketball court and still finish that game, right? It's just no big deal. But as we get older, it just gets a little bit harder to manage. And then there's the anxiety related to falling, right? It could be a very, very traumatic event. Maybe it led to worry about what was wrong with you, or you had to go to the ER, or maybe it was particularly painful, or worse yet, you had to be admitted to the hospital or have a surgery or go to rehab. And that can just lead to a lot of stress and worry
stress,
about
anxiety,
falling.
You're leaving your home.
Yeah.
It's like this morning I was fine, and now I have to go to a rehab.
Yeah, and a lot of people worry that once they leave their home that they won't get back to their home, and that can be really scary. And that kind of leads to like the fall cycle.
Okay.
So
tell me about the fall cycle.
Yeah, so you fall, for whatever reason, no big deal, yeah. And then that leads to that like increased fear of falling because it was so traumatic for whatever reason. And then you decrease your physical activity. So maybe whatever you were doing when you fell, you just don't want to do anymore, like walk around the block, or maybe you were playing with your dog, or whatever. But whatever it is, you're just afraid to do it because you're afraid to fall now. So then that leads to decreased physical activity and ability. So you just get weaker, you get less muscle strength, you get less balance because you're not practicing those things, you're not using them. And I mean, if you don't use it, you lose it, right? And then you have an increased risk of falling, and you fall again, and the cycle starts all over.
And then you're just traumatized.
Yeah, yeah.
I am sure that what happens, even with my grandmother, was right after that, she didn't go to the sink ever again.
Oh,
so,
yeah, see?
it
And she
becomes
really
a
loved
thing.
that.
And that was her thing.
Yeah.
So
Yeah.
that was a learning process for us. What are some things that people can do to prevent falls? Like home hazards?
There's lots of stuff. So I think home hazards is a really good, easy place to start. I think we have an image for that. Yeah. So now this image is really about lots of home hazards. So you might see some fire hazards there and some medication safety concerns. But let's focus on the falls. So you see the lady in the back coming down the stairs right there. There's a whole host of problems right there. So first off, she's got on those little house slippers, right, that don't really have a back on them. Well, those don't give you any grip if you start to fall backwards because that house slipper is going to come right off, right? It's not helpful. She's on a stair there, a set of stairs with no handrails either side. No handrails either side. That's super dangerous. And then all that
and no handrails.
Yes,
She's
right.
brave.
And then look, she's got to navigate around that box that's sitting on the stairs. So all that clutter is a problem. I mean, I'm not telling you to throw out your stuff, but you definitely don't want to put it, on your stairs where you need to where you need to walk down. I'm bad about that. Like
Yeah.
I feel like if I put it there, someone's going to take it
it,
upstairs.
right.
No one ever does, but that's in my mind anyway. And then, right below that, right at the bottom of the stairs, you got that area rug. Very risky. Very, very risky. Yeah.
So you might have made it down the steps and then get that rug, and it's
Yeah, you made it.
not so smooth sailing.
We just managed 1/4 of that picture there, but there's a whole lot there, right? There's those cords and the other stuff just sitting out in the middle of the floor. The cat is pretty cute, right? But I will tell you that pets are kind of sometimes a home hazard. I love my dogs. I have 3 dogs. I love my dogs. Absolutely love them. But definitely when they start moving around your feet or they pull on that leash, I mean, there's just some risk there. So you need to be aware of it. And the phone. Look at that phone is up there on that table, right? And we're gonna. Maybe this is an old picture. Nobody really has a phone like that anymore. But you can't reach it. If she were to fall on the ground, she wouldn't be able to get to that phone.
Right.
So most people have cell phones now, but you need to be able to have something on you, whether it is your phone or some sort of alert button or something of that nature, so that you can call for help, especially if you live alone, like we were talking about before. Yeah.
So that's one of the things on your list, especially if you live alone, things that you need to have.
To at least think about, what is my plan if I were to fall down?
And we did talk about the vision and fall risk. So and I don't think people think about that part.
Well, I mean, there's just so many age-related vision changes. I just think it's really important that you get that yearly eye exam. You need to make sure that if you're having loss of vision, that you're aware of it and that you're doing everything you can to prevent that, making sure that you get your glasses updated, making sure that you're being checked for cataracts, and your eye doctor's going to do all of that stuff if you go in for a visit. I just don't think that people really think of that as part of their regular preventative care. Yeah.
So when you were saying that for their regular visits, often people forget the ancillary visits.
Yeah, right. I mean, I don't know that your dentist is going to lead to any fall prevention, but dental health is also really, really important. Yes. I'll think through that. Maybe I'll find a way to connect that. But yes, all that stuff's important too. Sure.
And often, even with your eyes or your teeth, people often don't go to see their provider until something hurts.
Yeah. Yeah. And a lot of times it's too late, right? Like, yes, an ounce of prevention's worth a pound of cure. So for sure.
And yes, that's always just trying to make sure people are aware. And what are they learning? It's like that could have been prevented.
Yes.
So
Yeah.
that's always really scary.
Regret is hard. Yes.
I like
sure.
that. And with the medications, and that might and people might fall from their medications.
Oh, yeah. So, I mean, certainly as we age, right, we get all these other medical problems. It is what it is. And with the advances of medicine, there's a lot of things you can take for that. So if you're 65, I think the average 65-year-old is on 5 medications. And I mean, for some people that sounds like a lot. For other people, they're like, oh, I'm on way, way more. But those medications all have side effects.
Right.
So some people tolerate those side effects really well. Some people, can't take a medication at all because of the side effects. So that's a very individual thing. But a lot of common medication side effects include orthostatic hypotension, which is like where when you stand up, you get a little lightheaded, right? You got to steady yourself. We'll tell people that have that, you got to stand and steady yourself before you move. Got to let that blood flow catch back up with your brain when you first stand up. That's what makes you lightheaded. There's also dizziness and weakness and sleepiness and trouble with balance. All those things are listed as common side effects. And then you think if you're on 5 medications, right, you could be having certainly some of those. Also, when you add another medication, that risk, if you're already on 5 and you add 1 more medication, you have about a 50% chance of a drug-drug interaction with that, and that interaction is probably going to lead to one of those side effects, which then increases your risk of falls. Now, I'm not telling anybody to stop taking their medication. Right. But you do need to think about it and talk to your doctor about it, your provider about it, because it could be contributing to your feeling of being off balance or to your falls, and it's worth taking a look at. There's also this well, I guess it's a tendency in medicine to do this cascading prescribing. So you're on a medication which causes a side effect. So then we start a medication to treat the side effect, and then that causes another problem, and then you start another medication, and so you end up leading to all of these meds, which then ultimately can increase your risk. People also, they can be on the same med for a long time, like 10, 15, 20 years, whatever, and they've never had a problem with it before, and then they start to notice a problem. And, a lot of people won't even believe that. Like, I've been on this problem or this medication forever, and I've never had a problem. Why would I have a problem now? Well, when you age, all those changes occur. We've kind of talked about that. You have that loss of muscle, which is kind of where medications get distributed to when you take them. You have a decreased total body water. That's kind of normal when you age. You're just a little bit drier than your younger counterpart, and that's where those medications are diluted in. You kind of have less blood flow to your kidneys and your liver, and those are the workhorse organs for managing all those medications. So even if you've been on it forever, now it can be causing you symptoms because all of those things, the water, the muscle, the metabolism of it are all just going down. So it's something to think about if you're struggling with balance or falls.
That's why it's so important to communicate to your provider, correct?
Yeah, right. Absolutely.
Because what you don't think is important could be a major problem, and if they're not aware, then you're not getting treated for those particular problems.
Absolutely.
We have, what are some groups of people who are at higher risk of falls?
Well, those things we talked about that occur with age, they get worse as you get older. So, you're at a certain risk in your 60s, but that increases as you age. Those things are all worse when you're 80. So the older populations for sure. People that live alone, certainly we talked about that. People who have osteoporosis or vitamin D deficiency, so those people, when they fall, their bones are a little more brittle, so they're just at bigger risk for sustaining fractures and injuries, so that's important to talk to your doctor about whether you're at risk for those things. And then, of course, those medications. When you're on all those medications, you're at higher risk.
So the people that have osteoporosis should have been, there's tests.
Oh, yeah, of course. Yeah, there's screening and treatment for osteoporosis, yes. Dr. Kretschmann, our endocrinologist, would be really proud of me right now that I said that. Gold star for me. Hopefully she sees this, right? Yeah, absolutely. It's not something we manage in the ER, but there are plenty of, very qualified providers out there that do that. But yes, testing and treatment, and vitamin D deficiency needs to be assessed as well. Absolutely.
We have what are some of the things that Reid has to offer people with fall prevention?
Oh yeah, Reid has a lot of programs. My mother actually dropped this off for me today. This is the Reid Fitness.
It's always good to have.
Yes,
you might be the doctor, but your mother knows.
Yeah, right. Well, she's a doctor too, so she knows. So she knows. Yes, absolutely. So yeah, they have lots of stuff. So they have some medical fitness classes that are really designed to help prevent falls and keep people moving. They have some specific classes that are for specific kinds of medical diseases, like Rock Steady Boxing is for Parkinson's, but then there's also just kind of move well programs that are to help you maintain strength and maintain balance. They have a Be Steady fall prevention program where you can get one-on-one sessions and small group sessions if you really need someone to focus on you and what your issues may be. Yeah.
And most of these classes, you can find them if you come to the Reid site, as well as you can also, I'd be remiss if I also didn't talk about the ortho walk-in clinic.
Oh, yes. Yeah, well, I mean, there are lots of places to get your injuries evaluated, right? So if you find your injury to be minor, you're always welcome to go to the urgent cares or to the orthopedic walk-in clinic, or of course, if it's not minor or you can't walk or drive, right?
Going to the emergency.
Yeah, absolutely. We are there for you 24/7 in the emergency department. Absolutely.
Another thing I'd like to talk about is fall prevention for everyone.
Sure, absolutely. There are some really simple things you can do. So you can start by getting your yearly eye exam, especially if you're over 65, because if you've got a vision problem, you want to make sure you get it managed. You want to review your medications with your provider, be absolutely certain that you're not on anything you don't need to be on or anything that could be causing you symptoms. You want to talk to your doctor about osteoporosis and vitamin D deficiency and make sure that you're optimized there. You want to think about your risks at home and reduce those wherever possible. You know, get the clutter out, make sure you've got the handrails and you know, no area rugs that you're going to fall on, right? Think about railings, raised toilets, grab bars, lighting, like darkness is a risk as well. And commit yourself to a strength and balance exercise program. Make some time for yourself to make sure that you're staying as strong as you can and keeping that balance tip-top.
The other thing, I know we showed the home hazards, but also I've seen people now with with their cars or like big SUVs. Is that when people try to get in and out of those, that can be a hazard as well?
Yeah, it certainly can. I mean, everybody loves those big SUVs, and they have those step bars there, right? I see a lot of falls for I was at the step bar and it was wet, or I missed it, I stepped down, I missed it, went off the edge. Yeah, those can certainly be a danger.
So, wow.
Yeah.
Well, I want to thank you, Dr. Bales, for joining us today on Let's Talk Together.
Well, thank you so much. I enjoyed being here. It's always fun talking to you.
Well, great. And thank you to our community for joining us on Let's Talk Together.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.